Good afternoon and welcome to the third in our series of podcasts where we're imparting information to support our community through the difficult and challenging periods we're facing in this COVID lockdown. Amanda Starr's joining me again. People who are tuning into the podcast will already be familiar with Amanda, having done previous podcasts and having done the last podcast that we sent out. We're also joined by another of our colleagues from Copeland Council, Emma Williamson, who works with Amanda in her team. And I'm also delighted to have some of our partners join us on this podcast. We've got Kerry Jewell from Family Action, who's the service manager there. And I'm delighted also to have Joanne Crowe with us, who's well known in the local community as the Chief Executive Officer at the Phoenix Enterprise Centre. So ladies, thank you all for joining me today on this podcast, and we'll press on and get things moving. Amanda, it'd probably be an appropriate place to start by talking how Copeland Council works with our partners.
Yeah, thanks, Mike. I'm really pleased to do this particular podcast because we've talked on my previous podcast about our statutory duty, but really where the good stuff happens for our communities is all the wraparound support that we provide, which goes over and above our legal duty as a council. So that's really what we're going to talk about here today. And what we do is we join together with other statutory partners, so the county, police, and our third sector partners, as well as private sector. So for instance, organisations from Sellafield in the supply chain. We join together through a group called Thriving Communities Group. And what that group's about is making sure that we all work together as equal partners to be able to provide the services that communities need and fill the gaps. So Copeland has been obviously a real test of that partnership. And I think we've achieved fantastic things. And what we're going to talk about today is the difference that can be made by our third sector partners, voluntary organisations in the community. And we've got two of our really key strategic partners here today in the Phoenix Enterprise Centre and Family Action. So it's going to be really great to hear about some of the work that we've been doing, because we can't do it on our own. So it's all about communities, and it's all about us working together with third sector partners as well.
I agree. I think we should sort of state at the outset, through the first lockdown, the way our partners and volunteer groups, for that matter, came together to work with the council. It delivered some fantastic outcomes for the whole community, from care packages to food parcels, and a lot of that's what we're going to talk about. To recap on the previous two podcasts, we've talked about the business grants that the council are facilitating. We've talked how we're helping with low-income families with council tax reductions and housing support. And, earlier today, Amanda, we talked about sort of practical support for homeless people threatened with homelessness and people who are suffering from varying kinds of abuse.
Yeah.
I think in this podcast today, we want to talk, about food and financial support that's available. Emma, do you want to just give me a little bit of an overview of where you fit into the jigsaw here and what your role is now in driving this forward for Copeland Council?
Yes, so I'm Copeland's Community Resilience and Social Inclusion Team Leader. So I work with our community groups and organisations to deliver our social inclusion agenda. So one of the big remits, and not just because of COVID, but one of the big remits is around financial resilience. So I work in partnership with our partners to deliver that, and how I fit in is to work with our partners to find a solution for some of the issues that we're dealing with. So I work really closely with Joanne around the Thrift Hub, which Joanne will discuss later about the provision that she's providing. But I also work really closely with Family Action around delivering initiatives for our young people and our children. So we're very much a partnership approach. And how we do this is we look at the issue and we find a solution collectively. So it's not just one of us driving that forward, it's looking at it in a partnership approach and looking at how we can do that. And I do have to mention as well our community groups are very much part of that solution.
Okay, thanks very much, Emma. Joanne, can I come on to you just to talk about some of the practicalities? Phoenix Enterprise Centre, long-term partner of Copeland on many different projects. Well, do you want to give us a bit of an overview, Joanne, on what practically Phoenix Enterprise Centre are doing now and how they're working in partnership with both the County Council and Copeland Borough Council?
Yeah. At this moment in time, we're delivering a project called the Food Pantry or the Thrift Hub. It has two names. Funded mainly through the County Council, but supported greatly through Copeland Borough Council. Its aim really is to get food to people who are struggling to buy food. We're based in Cleatamore. We're a community interest company, so everything we do is for the good of our community. And we are supported there by Cleatamore COVID support group, who set up through the first wave of COVID. They help us with volunteers, bagging up bags of food and for delivery drivers to get that food out. And since July, I think we've had 74 families who have accessed food through our food pantry or thrift hub. And those 74 families come to us when they're struggling. We look at, why are you struggling? What can we help you with? And people struggle for a number of reasons, and there is absolutely no shame in it. People struggle recently, it could be that they're having problems with their benefits, universal credit, things like that. It could be that they're in debt. Sometimes people have been in persistent debt for the longest time, and they just scrape through, they get through, and now COVID arrives and it's just too difficult. A lot of people have been furloughed recently, so instead of getting their full wage, they can be anywhere from 80% of their wage to 70% to 60%. A lot of people live, really to the limit of their means. And once they've lost that 20 or 30 or 40%, they just really struggle. Unfortunately, you could have lost your job. And if you've lost your job, you've still got all those same outgoings, coming out of your bank account every month. But you don't have the same money going in. And all of a sudden, you need help. We have people who have an immediate crisis. The cooker's broken, a big bill's come in, and all of a sudden you're struggling to, afford food. So what we want to do is support those families who find themselves in that situation. Come and talk to one of our advice and guidance workers. Come and see what we can help you with. There's an absolute mountain of support out there right now. You've just got to come and ask for help. We can refer you to the likes of CAB, or Citizens Advice Bureau. We can get you on to credit unions, low cost loans, step away from the doorstep lenders. Let's get into some good financial habits. We can help with things like council tax reductions, getting you onto Copeland Borough Council, getting you the help to get that council tax reduced. We can look at, talking to the DWP on your behalf, looking at getting maybe any debt that you have with the DWP spread out over a number of months to reduce your outgoings. We can look at getting you help with gas and electricity through Ways to Welfare. There's all kinds of ways that we can help you. We can refer you to Family Action for support through some of their programmes. But while you come to us and while you're working with us and while you're letting us help you, you can access the food pantry off the Thrift Hub, and you can access either free food or heavily subsidised food. And some families come to us for 2 to 3 weeks whilst we sort out an immediate problem. Other families stay with us maybe for 2 to 3, 4, 5 months until we get that longer term solution for them. But either way, come to us, come and help, come and ask for the help. And if you work with us, we'll try to get you through it.
Thank you very much, Joanne. Kerry, same question. If you could give sort of an overview of where Family Action fit into the overall picture and where our residents can get support through Family Action.
Yeah, so I think for Family Action, so we've continued to work right throughout. So we've noticed the number in referrals have increased. The families that we're working with have struggled financially. We've offered a lot of support financially. We refer to food pantry, we join the food hubs. We work along with partnership agencies in making sure that the families that we support are getting that right support. I think for us, we notice that when families do come to us, they don't really like to engage right away. We've got to build relationships, and therefore they won't work with anybody else. So when they do come to us, it takes a lot of time for us to build relationships, for us to refer on to the right agencies. But we do a lot of the work. So financial support we offer families, and we've done that through Family Action. Have had our own grants over the last several months, and we've supported families with vouchers for shopping. We've offered goods. We can support with white goods. We've also done a lot of groups around low-cost cooking groups, and we've had around 100 families that have joined our groups. So we've got workers that will do this through Zoom, and we supply the food bags to the families, because families just sometimes can't afford to buy food bags. So we found that if we do that, they engage better with us. Not only that, it also builds relationships, but shows them that it doesn't take a lot of money to cook good meals. A lot of our families will live on some pasta or easy making meals. So this way we've learned them how to make a shepherd's pie or a cottage pie, and they've never done it before. So children are coming in from school now to home cooked meals, which is fabulous. We've also supplied families with a lot of emotional support, especially children. Children are now coming to us because of COVID and what's gone on during COVID. They're really struggling getting back into school and getting back into the community. So we've done a lot of work with schools and with partnership agencies and building that support with young children as well. During the summer holidays, we've engaged with the youth partnership agencies, and we've supported with fun, fit and fed activities. Again, that's around looking at healthy lunches and also the active side of things, where children during lockdown haven't been active at all. And we find a lot of the children rather stay in the bedroom rather than getting out into the community. So we've worked with partnership agencies in making sure that they are getting out there. I think with the financial side, we work with CAB quite a lot, and we refer a lot of our families on, but the families we do refer on, we support by going to the appointments with them, because they've got that relationship and trust. And I think if we send them by themselves, they wouldn't go, a lot of our families. So we encourage them to go by us attending appointments with them. I think for referral way with Family Action is we take referrals for just about any service. We're open 5 days a week. Hours we support families at weekends if we need to support families at weekends. To meet the service needs and what families need. I think we support what we need to do. So referrals can come into us, and from them we obviously build relationships and look at referring on to who we need to, or what work needs to be done with families.
Emma, how are we coordinating this to make sure that people aren't slipping through the net and that we're identifying the people who need the support of services like Phoenix, Family Action or the local authorities?
So that's by working with our partners, but also working with our community groups. So making sure that those who know a neighbour maybe hasn't had his curtains open for a couple of days, or maybe going out into the community. So although we're all working from home, we are all still very connected with our community. So it's working that partnership approach. So for example, one of the projects that we're going to do at Christmas is around our older generation. And that's working with partners to get Christmas meals out to them on Christmas Day and a hamper. So, but that is just the hook, because what we're going to do is put a little questionnaire in those hampers, and then we're going to go out with our young people and befrienders and trained volunteers to then collect those little surveys off them on the 27th of December. So we're checking back in on those people. So it's kind of using projects, using food, using our other organisations to identify them, but then to continue to work in the community to go out and ask what they need, how they're there, and anything that we can do to support them. And that's the little questionnaire will ask that. You know, what kind of things can we do to help you? Do you know about these services? Because not everybody has digital opportunities, not everybody has a computer or anything like that. So it's getting that physical questionnaire out into the community, into people's houses.
And, you know, just to be clear for anybody tuning in and watching this podcast, this level of support is available throughout Copeland. You know, it's not just North Copeland or, you know, Cleatsmoor or Egmont, you know, everywhere from Millham to Dizzington and everywhere in between, where we're covering all the ground.
And I think, you know, it's important to say that we've got community groups and food pantries all over Copeland. So, for instance, Millham has its own food pantry, but Joe and the Millham Food Pantry are connected and in conversation. Similarly, Dizzington has a food pantry and a food offer as well. But you know, one of the things that we are doing is we've got a food and finances group, and I chair that group. And everybody who's involved in the food provision across Copeland, in the community world, is involved in that group now. And Emma's just touched on something there that I thought would be interesting to share today. We're starting to think now about what's going to happen over Christmas. So there's fantastic projects that are all ready now. They're not all. This is the trick of it. They're not all ours, but we all need to be involved so that we can refer people across and in between, so that nobody falls in between two stools. So if you've got that really strong network, you can kind of cross-refer. That's what we want to try and do.
And if I can just build on that really quickly, Manda, one of the things is recognising that we don't have to solve everything on our own, because what COVID has done, it's really brought the community together and they're coming up with their own solutions. So if I can give an example for the Jordan Mattinson, he's doing a big campaign around donations for food for free school meals for children and young people. And it's working with him to make sure it reaches the right children, and that's where Family Action come in. So a lot of the time it's just being a connector, an enabler, and supporting people to be able to deliver things themselves as well.
Can I just come in and say about Christmas that this Christmas I'm absolutely delighted that Phoenix Enterprise Centre remain open over the Christmas period, and sometimes in that period, especially those 3 days between Christmas and New Year, when everybody else seems to be closed, we do get some very complicated cases with families who need, you know, multiple levels of help. And this year, you know, Kerry and at Family Action are also going to be open. So, you know, at Cleatsmoor, we're going to have Phoenix Enterprise Centre open, we're going to have Family Action open, and we're going to be able to give a really sort of partnership approach to supporting people over the Christmas break, which I think is really important.
Yeah, I do myself. Kerry, how have you seen demand in comparison to the earlier lockdown in March?
I think the demand is huge at the moment. I think at the start of lockdown it was really quite slow for us, but now obviously we've moved on. Demand is huge, so our referrals have rose. So we've gone from 164 referrals right at the start to 411 referrals now, which just shows the impact it's having. And they're for right across our service, but a lot of the thing we find is when we get into families, it's not just about behaviour, what's going on in the home. It links to obviously financial, the situation, what's going on. And if we can help sort that by working with agencies, we've got a good start working and supporting families moving forward. But yeah, it's huge.
Joanne, is that reflected in Phoenix? Is this what Kerry has just said reflected in Phoenix as well? Are you seeing a big increase in demand?
Yeah, there's certainly a bigger increase in demand for food, and it's things like, because sometimes people say to me, well, that person's been on benefits for the last 2 years, so why should COVID have made a difference? Why do they need food now? But if you think that you've got a mum with 3 children and COVID hit, now before you maybe used to make one trip down to a budget supermarket in Whitehaven on the bus and got one large shop. But when COVID hit, she couldn't take her children and certainly couldn't take 3 of them around the budget supermarket because of the risks involved. And those people, that lady maybe then had to go to the local corner shop to try and feed her family. Well, the local corner shops have given a great service over COVID, but the choice is limited and the prices are higher. So all of a sudden, a mum on a budget with 3 young children just couldn't make the budget, you know, stretch to feed her family over that week. That's why lots of people, or one of the reasons why lots of people all of a sudden have needed help. And, you know, that's what we're trying to do, is to provide those services and to provide the help that they need. And before we go, Mike, would we be able to give you our contact details so people know how to get in touch?
Yeah, absolutely. And what we'll do is if you email those into me as well, Andrew Clark will, and if you email those into Amanda, then our communications team, I'll attach all this to the link when we put that out. Yeah, Amanda, you know, from a Copeland perspective, you know, the council, local authority, we're trying to coordinate all this and make sure the net spread as far and wide as possible. What are we seeing in terms of demand as a council?
Okay, so what we find is that when people come to us for frontline services, and that can be anything, you know, the statutory services that council provides. We talked about housing, but it's not just that. It could be council tax, it could be customer services, it could be people ringing actually about an unrelated issue, such as, you know, waste or you know, just a general inquiry. And often in those conversations, things emerge, you know, with our staff. And one of the things that we've been doing, which is a Copeland Borough Council project, is our social prescribing project, which we wanted to tell people about and raise awareness about this today. So what we've been doing is training our staff to have kind of have like what we call kind of open eyes to people when they first come to us. And it's not a case of, well, my job's housing, I just deal with housing. It's a case of, okay, let me listen to you. Let me think about what are the wider support needs that you might have and how can we help you to do that, so that we're signposting people, we're advising them, we're saying, did you know about the thrift hub? You know, that might help you. One of the big pressures that we are seeing is around mental health. And I'm sure my colleagues on this call will support this. It's a you know, extremely growing area in terms of support needs. So right across the range, if it was a sort of a serious mental health issue, sometimes we do have safeguarding issues. We have self-harm and threats of suicide that are made through our staff. And that has grown. And I can tell you, 2 weeks ago, I had 5 safeguarding reports in the case of 1 week. And generally, you probably would get that over a month, if that. Now, if they're serious safeguarding reports, then we will make the link with the appropriate statutory agency. But where social prescribing comes in, and the impact of COVID, is that, you know, that sort of lower level anxiety, social isolation. Some of it can be as a result of debt, some of it can be family issues, tensions at home. Whatever it is, social prescribing can help with that. So it's a bit of a funny term, but basically it means that social prescribing is where you acknowledge that it's not just about going to your health professional like a GP for help. And what we found was that GPs were saying a lot of people are coming to see us, but it's not really a medical thing. You know, it's say it's social isolation, or somebody has suffered a bereavement and now they're quite isolated. So it's about saying, well, let's prescribe some help within the local community, and it can be putting people in touch with activities or community groups, stuff that's going on around them that might be able to help with that. So this is a key project that we're running in-house, and we have 2 specialist staff that work with Emma on that. So I'm going to ask Emma, do you want to say a little bit more about social prescribing and the kind of work that we're doing to support groups and people?
Yeah, so one of the key examples I want to give, because I spoke to my team about this week, was when the government announced that we're going into lockdown. Government guidance can be quite hard to understand for our community groups and our organisations. So our team were really good at supporting those groups to understand it, but also everybody who had to close, some of it was to do with a venue because they didn't have a venue. So our team have been working with them to make community groups understand that not all of them do need to close. So some really vital social prescribing activities around drug and alcohol are now going to continue because of the work that our social prescribers did. So they're very much about there, not just supporting the groups, not just supporting the individuals, but they're also there to help them identify any gaps. So if there's any projects that aren't being delivered, our team are very good at sort of going in there and advising and supporting, and very much building that infrastructure within the community. So Amanda touched on mental health before, and we know that a lot of our organisations have waiting lists. So our social prescribers are in there looking at funding opportunities to be able to support them to grow, being able to make sure they're not overprescribed because they can put in support in. So our team have done a fantastic job during COVID, and also working with our COVID groups. So we know that there isn't the demand around volunteers before because a lot of things are open. But if you take the thrift hub, for example, we know that your demand's increased. So our social prescribers have identified some volunteers that can come in and support. So it's very much about supporting volunteers as well. So connecting volunteers to organisations that might need some support, and not just during COVID, that's, you know, post-COVID as well, to be able to build on that. So it's really important.
Yeah, that's it. Kerry, you know, in your organisation, are you seeing this strain on mental health increasing?
It is, yeah. The mental health within the work we're doing with families has increased. I think, again, it's about when we get in there with families, the referral comes in for behaviour, but when we get in there, the mental health of the parents and the impact that has on the child it is huge. And I think it's about us working together to make sure we can find the right support to support the parents, because not everybody's trained in mental health or dealing with the mental health. So I'm really keen to work with as agencies the best we can to make sure we support the families in Copeland with the right support as soon as possible.
And Mike, as well, people can self-refer, so it doesn't have to be via an agency. Agencies can
Where do you
also
self-refer to, Amanda? You know,
Okay,
if people are feeling in that situation, you know, where do they go? What do they do?
So on our website, there's a directory, it's got all the names of agencies across Copeland that can help. Okay, so the best thing to do is that, again, we'll put a link on so that people after this podcast can click on it, and there's a directory. It's not just mental health, it covers everything that people might want to access in terms of self sort of support, to make a call or drop an email or go on a Facebook page and make themselves known, and these groups will be able to provide support. If people are seriously unwell, so, you know, if we're talking about people with serious mental health concerns, like possibly self-harm or threats of suicide, then we do safeguard those people in a different way, because they probably need to be linked in with proper mental health services, and it can be both, to be honest. I mean, people can come in and out of crisis, so at some point they might need to access the crisis team, which we can help them to make that contact with. Or it may be that actually they're feeling quite well at the minute, but they could just do with a little bit of support and making contact with people that understand, you know, how they're feeling. It could be anxiety or low-level depression, that kind of thing. But basically, I'll put a link on the podcast, and people can go and have a look, and they can make that connection themselves.
That's ideal. You know, at the risk of repeating myself on all of these podcasts that we do, I would ask anybody who's tuning in and watching this to share it with as many people as possible, and make sure the people who can benefit from some of the information that we're giving out on this podcast, you know, gets to hear it and gets to find out about it. And if you're in a position to support people to refer, as Amanda's been talking about, or to identify to the appropriate place what help you need, you know, I think the clear message that I'm getting coming through from all the members of staff in Copeland that I'm talking to, and partners such as Joanne and Kerry, is that there's a huge commitment to support and help and make sure the community comes out the other side of this pandemic in good shape. The overwhelming message is, you know, whatever the situation, there is help out there. So, you know, and we're trying to make sure that you can access that help, whatever, you know, form that takes. You know, I'd ask Joanne and Kerry if you get any links that you that you want added to this podcast broadcast, if you can let Amanda know, and our communications team will pick that up. We'll be sharing this far and wide, and as I've said, if people could share the information on. Does anybody wish to make any concluding message, final message? Joanne, have you got a final message you'd like to leave before we close this one off today?
Kerry mentioned the rise in mental health. We are finding a rise in addiction issues as well, but that again, of course, goes hand in hand with the mental health issues. One thing I haven't mentioned that I should have mentioned is that we have access to a small pot of funding called the Hardship Fund. Again, it's held by one of our partners, but comes through Copeland Borough Council. It is a very accessible pot of money, if you like, and it's there and it's quick. And if speak to one of the partners, CAB, to the credit unions, to ourselves at PEC, and we can access this hardship fund, and it's so flexible. It can help with a range of things. But just come and ask. There's no shame. There's no stigma. It's all confidential.
Okay, thank you very much, Joanne. Kerry, have you got any concluding comments you'd like to make?
Yeah, I think it's just to make sure that families are aware that they can come forward for any support at all with us, whether it's family support, financial support. It's just about picking up that phone and making contact, and then from there we will contact the family and offer long-term support if needed.
Thank you, Kerry. Emma?
It's just very much about the partnership work and that we're doing. I just want to thank all our partners, all our community groups. And I also want to call out is if you need support, please get in touch. That's what we're here to do. We're here to support anybody who needs anything during this difficult time.
And finally, Amanda.
Yeah, I think just reiterating what Emma said, I was going to say about the partnership working. I mean, what we've got here is statutory agency and the third sector working in partnership. And that's been the experience throughout COVID, so it's fantastic. And I think my last comment would be, watch this space for Christmas and see what's coming up then. People can be aware of what they can, what's out there and what they can access over the Christmas period, because that's what we're working on there.
Yeah, and final one from me. If you are tuned in and you are watching, and there's areas that you feel we haven't covered or questions that haven't been answered, post them either through a private message or on the link. We're all looking at the comments as they come through, and we will get back to people with the information that we might not have been able to impart. We're trying to get out as much as we can, as quick as we can. But if any feedback is welcomed, and we will act upon it. Joanne, Kerry, Emma, Amanda, thank you all for joining me on today's podcast. I think that was really fantastic information that will be really, really helpful. Thank you all very much.
Thank you.
Thank you.